Quick recovery to the news guy. I've heard that he's been battling some kidney issues, which was related to UTIs. And some of you have been coming to my inbox. Doc, does UTI lead to kidney failure? And the answer is yes. And this happens mostly if the UTI is left untreated, or if the UTI is not managed well, or you've been having recurrent UTIs. So the most common suspect in UTI is the E. coli bacteria. So this bacteria may invade the bladder, and once it has invaded the bladder, now the function is to go upstream, and the next step is to go through the ureters. The ureters are the ones that connect the kidneys to the bladder. Okay, so that bacteria will climb through the ureters and reach the kidneys. And once it reaches the kidneys, it will target mostly the nephrons. And the nephrons, from biology, they are the functional unit of the kidneys. They are the ones that the filters are located in. And if these nephrons are affected, or they're attacked by this bacteria or any other urinary tract infection, then they begin producing pus. And this pus blocks the main function of the kidney. Those nephrons, they block the main function of the kidney, that is filtration. Okay, and this is known as pyelonephritis. Okay, PYELO nephritis. This is inflammation of the nephrons. Once they are blocked, then you'll start having those kidney issues. For severe cases, those nephrons with recurrent infection, recurrent UTI infection, every time you are infected with a UTI and you leave it untreated, or you manage it poorly, the nephrons are destroyed. Pus is filled, it blocks, it causes scarring, and it blocks the nephrons from functioning. So the more you continue ignoring these UTIs, the more the nephrons are destroyed in the kidneys. And once the nephrons have been destroyed completely, then you'll have kidney failure. At this point, you might need a kidney transplant. You might need dialysis. So that is how serious this is. But this is only for those that are poorly managed, the UTIs that are poorly managed or maybe ignored. Okay. So what are the symptoms that we are looking for? We are looking for flank pains. If you have flank pains are lower side abdominal pains. Okay. If they're accompanied by fever, then it's very serious. If they're accompanied by nausea, the feeling of vomiting, then it's a serious case. So to news guy, quick recovery. You'll get through this. If it has been identified early, then it's very easily managed. For those others out there, especially our women who are mostly predisposed to UTIs, especially from the public toilets, or if you are sharing the toilets with other unhygienic people, please be mindful of UTIs. UTIs can make you lose your kidneys. Are we together? Do not be afraid of STIs and take a light note on UTIs. UTIs also can be very fatal. So let's be mindful of our health. Your health is your wealth.